coughing and coughing and coughing, and go in, and it was continuous bronchitis, supposedly, and I would get an antibiotic or I would get an inhaler, and then it would happen again and again and again. I actually was one of the people that lived in a bubble of thinking that only people who smoked got lung cancer. Was tied to the running marathon. I was running one in Nashville, and I literally coughed for 13 miles. And I got to the end, and my sister and my niece was with me, and they were like, you need to find a doctor. Like, there's something going on. Lung cancer was not at all on my radar, obviously, but I went to a different general practitioner that I had been seeing, and she said, I'm sure there's nothing, but I'll send you for an x-ray. I go get an x-ray, and I'm at an airport a couple of days later, going to meet a friend for a girls trip. My husband was going on a golf trip, and she calls me at the airport and is like crying. But she said, it's clearly metastatic. Both of your lungs are filled with nodules. And so that was the beginning of all this. I think it was just shock, I will say. Paul, my husband, was much more emotional than I was. He was really upset. And I was kind of like, I don't know if I didn't believe it or I don't know. I would say it was shock. My first instinct, I think, right off the bat was, okay, how do I make sure things are okay for my kids if something happens to me? That was really what I thought at first. And my sons were young adults, but still, it's just, I think there's this idea that when your kids are a little bit older, that they can handle it better. And what I feel is there's like nothing like telling a 20-something man that his mom has a terminal illness. Like because they have such a clear understanding of it. It was hard. It was hard in a different way than young kids, because I was obviously got to be there for their young life, but it is very hard. I'm so grateful that I was at the right type of cancer center that stopped me from immediately going in for immunotherapy or chemotherapy. Also, my oncologist did 2 tests when the first one came with no biomarker, and I feel profoundly lucky because I wouldn't have known to push for that. I was really lucky at that particular time, although I later was lucky enough to be a patient of Dr. Camidge. So we did another test, another biopsy, and it came back with ALK positive. And once again, I had no idea what that meant.
For ALK positive, what happens is there's a gene which is involved in your development when you're a little ball of cells inside your mummy's tummy. That gene is involved in, moving cells around and, forming your organs and all the things that happen even before you even look like an embryo. And then it gets turned off. It's done its job. It's like, we don't need you anymore. Go to sleep. And what happens is when this thing that causes the cancer happens, that gene wakes up again. So they're sometimes called ALK fusions, ALK rearrangements, but they're all ways of waking up that ALK gene and saying, okay, go move cells around, go make things grow, which is fine when you're trying to create an embryo, but is not fine when you're an adult and that turns it into a cancer. There's one dictator sitting in the driving seat of your cancer, and you can do something about it, because there are different medications that can shut up the orders that are coming from different dictators.
I was extremely unknowledgeable. My family did not have any history of cancer. Even in my friendship group, there hadn't been a lot. And so I was really starting from square one, and we just jumped right in and miraculously started to impact me within a matter of days. So it was interesting. It was not something that I even knew was possible with cancer, that pills could do that for you, but that was where I started. My husband's always like, well, you could look at it like you're the luckiest, really unlucky person.
Some oncologists, I think rather unfortunately, will say things like, oh, you won the lottery, you've got ALK positive lung cancer. And you go, dude, you still got lung cancer.
I'm grateful to hear you say that, because I would say I hear on a daily basis that you won the lottery, not directed at me, but directed at somebody who was diagnosed with ALK positive lung cancer. Quality of life is my number one desire through this path. But I would say, try to learn as much as you can so that you know those right questions. And if your oncologist is not testing for another driver or not talking about second drivers when you have progression, try to be aware so you can bring it up, because local oncologists are not going to know every single thing there is to know about ALK positive.
Does it fall into one of the buckets of non-small cell lung cancer or small cell lung cancer? And then even under non-small cell lung cancer, is it something called squamous cancer or adenocarcinoma? Those are the most common ones. And they're really what it looks like down the microscope. And that gives us some kind of clues. And then the second question is, well, how far has the cancer spread? So what that's called the stage of the cancer, and that's usually determined, at least in the USA, by a PET scan and an MRI scan of the brain. And you try and do that because if it's a cancer that hasn't spread very far, maybe surgery is in your horizon. If it's spread a little bit more, maybe radiation is in your horizon. Whereas, unfortunately, something like 2/3 of people, the cancer has already spread beyond that phase when they're first diagnosed. And then the third question really comes into its own, and that's whether you have had any molecular testing done on the cancer. So sometimes that can take as long as 2 weeks to come back, depending on where they do the testing. So you're going to have a biopsy, you're going to have scans. That's the sort of thing when they tell you you've got lung cancer and what the stage is. And then before you jump into your first line treatment, if you can, you're going to wait for that molecular test result to come back. And that's the information that Nancee mentioned in terms of telling her that she was ALK positive. I want people to be able to go to their doctor with the expectation that they should have perfect quality of life. And if they don't, they need to write it down and remember to tell it to the doctor. And maybe the doctor can do nothing about it. But it's the Billy Joel song, tell her about it. Even though it's a pill, it's not benign. It's a powerful medicine that just happens to be available in a pill form. Probably the biggest thing in the short term is it can mess up your thinking in the broadest possible way. So it can affect your mood, it can affect your memory, it can affect your speech, it can affect your sleep.
It's just so important for people to take that seriously and watch what's happening in their brain and their body. That's a pretty big price to pay when it can be managed, if you work through that or lower your dose or do whatever other things you need to do.
Don't be afraid to go down on the dose. This isn't supposed to be punishment. Our aspirational goal is perfect control of the cancer and perfect quality of life. And maybe we don't achieve either of those, but that's still what we should aim for.
I have not been the greatest about sharing side effects along the way, and I have shared some. But in part, I think, and I don't know if this is common, it's because it's like, well, my cancer's not growing. I need to be more grateful. These are minor things in the big picture. And when I compare myself, which I know is, the thief of joy or whatever that saying is, to others, and they're doing so much worse and they're struggling so much more, you just feel like a whiner, which is, and I mean, for lack of a more professional word, that I have like really terrible neuropathy. And I would say that over time, it's so much worse. Like I had periods where it wasn't as bad, and I don't know if it's the cumulative effects of taking this medicine for such a long time. And I did have a dose reduction a couple of years ago, which helped for a little while. I have a great quality of life, but there are certainly some side effects that sort of just some days are that wear on you a little bit.
I think it's incredibly important. I'd also think that the caregiver or friend or relative, whoever comes with you, is also an important voice. Write a list of things before you go. Other people, particularly if they're in a clinical trial, might be worried they'll be taken off the clinical trial. Sometimes it's kind of cultural. It's like you don't worry the doctor with those things. But honestly, if we don't hear, we don't know.
When I was diagnosed in 2016, the only TKI that was available first line, there wasn't an option like there is today when people sit down and they talk through all the pros and cons. It was approximately a year when I had an MRI where I had brain metastases. And so I had progression, which is really common. I did not realize that. That's another place where I didn't do enough research.
So it's about 30+%, which is probably 10% higher than most forms of lung cancer. So there is a certain what they call tropism, a certain tendency for ALK-positive lung cancer to go to the brain more than other forms of lung cancer.
When I had the brain progression, in my mind, I now have brain cancer, which of course I know now is not that I had lung cancer still, that had metastasized to my brain.
The drug that Nancee first started on, and we're still grateful for it because there are people alive today who wouldn't be alive today without it. But nobody starts on that now, and one of its Achilles heels was it was very bad at getting into the brain, so it kind of left that area unprotected. And that's exactly what happened with Nancee. Now all of the new drugs have got activity in the brain.
If it does metastasize to your brain, it is not the death sentence or the horrible outcome that I thought it was. I thought that was just the end. And I had no symptoms. They were very tiny, but it just still felt so profound that there was this cancer in my brain. And I think I would just want people to understand there are many ways, many people treat it with SRBT. They're doing all kinds of things, surgical treatments, as well as, of course, really powerful TKIs now. And And like myself, it's been 9 years. It has inhibited those in my brain, fingers crossed, for a little bit longer, but that it isn't the horrible, it's not that different from progression somewhere else, I guess I would say, as I thought it was.
I can tell you that when I first looked at my scans, and I had a 2 centimeter lesion in my brain stem. And for those people who don't know, your brain stem is only about 3 centimeters across. And it was, when I looked at it, I was like, I shouldn't be alive with that.
I went for the chest x-ray Friday morning. By Tuesday morning, I knew that I had a specific mutation in my cancer. I knew that it was metastatic. I knew what the right treatment would be because I'm an expert in this.
We started in 2018, and then every year since then, we've taken a picture of all the people who are at least 5 years out from their diagnosis. We get them all in a room together and give them birthday cake and take a picture. And we stick it up in the clinic. And when I'm talking to patients when they're newly diagnosed, you can see that panic, that withdrawal on their face. And at some point, I just kind of, break the fourth wall, and I sort of say, look, can I just borrow you for a second? And I take them out of the room into the corridor, and I show them the pictures. And I say, I'm not guaranteeing that this is going to be you, but I am showing you that it's possible, that there are real people, not just statistics, who do it. And that you can see people kind of gather themselves together and say, okay, that's the challenge. I can do this.
I do try to remain in a place of gratitude that I've had 10 years, and there is a positive to having 10 years of knowing that, because you really do, I think, take the time to say things you want to say that you might not have, or to make sure you're at this graduation, which maybe I'll be here in 20 years, who knows, but I think it does make you more intentional in some ways, and so I'm grateful for that. So I think that's a way I manage through it, is to try to look at those positive things.